Hello everyone. Today we'll be talking about fractures, various fractures with eponym, and these are the fractures better known by their names. And mostly these names are given by the person first of all who has described this fracture. And today we'll be just researchly overviewing the various different name fracture. These are we have almost 30 fractures in the list, and we'll be talking about these all fracture in detail when we come to their respective chapter. So we'll just see the overview only for today. And first of all, we have the Monteggia fracture dislocation. For this is the fracture of proximal third of ulna with dislocation of head of radius. So we have the mnemonic for that, for this reviewing these two fracture. Next one is we have the Galilei fracture dislocation. This is the Galilei fracture means the fracture of distal third of radius with dislocation of distal radio ulnar joint. So we will talk about this in detail in the respective chapter, but for now the mnemonic is the MUGR. And here what happens is that in Monteggia there is fracture of the proximal third of ulna, and with the dislocation of distal, it looks distal. No, this looks like proximal and this look like distal. So there is fracture of proximal third of ulna with the dislocation of head of radius. So this is the this Monteggia fracture is basically the proximal type of fracture where there is fracture of proximal third of ulna with dislocation of the head of the radius. And in the Galilei type of fracture dislocation, the fracture of distal third of radius, we have the R, distal third of radius, fracture of distal third of radius with the dislocation of distal radio ulnar joint. Here there is the dislocation of the distal radio ulnar joint, and this is known as Galilei fracture dislocation. And in nightistic fracture, this nightistic fracture means that it is isolated fracture of shaft of ulna, and it is sustained while trying to ward off a stick blow. When some person tries to get defensive with when someone is trying to hit with them by stick, and the stick gets injured, got struck to the ulna, and that there is isolated fracture of shaft of ulna. And the Colles fracture, a fracture occurring in adult at the corticocancellous junction of the distal end of radius, and this is the fracture of distal end of radius with the dorsal tilt. And this is important to remember, this is dorsal tilt, and the other displacement, there can be other displacement. And in the Smith fracture, this is just opposite to the Colles. And the fracture occurring in adult at the corticocancellous junction, same as Colles, but corticocancellous junction at the distal end of radius with ventral tilt. These both are basically same, but here it has dorsal tilt, it has ventral tilt. And this is the reverse of Colles fracture. Smith is ventral tilt, dorsal tilt. And the Barton's fracture, this is also known as a marginal fracture. The Barton fracture is the intra-articular fracture through the distal articular surface of the radius. Distal articular surface of the radius taking a margin anterior posterior of the distal radius with carpal, and there is carpal is displaced anteriorly or posteriorly. This is intra-articular fracture of through the distal articular fracture of radius. Okay, this is also a fracture of upper limb, that is radius, and in the with the displacement of carpal. And we have next a Chauffeur fracture. That is an intra-articular oblique fracture of styloid process of radius. Again, this is the fracture of radius. Here this is also intra-articular oblique fracture of the styloid process of the radius. And the Bennett's fracture dislocation, it is an oblique intra-articular fracture of base of first metacarpal. Base, that is the thumb, we have the base of the first metacarpal. These are the other limbs, and this is the base of the first metacarpal with subluxation of trapeziometacarpal joint. So it is an oblique intra-articular fracture of base of the first metacarpal with subluxation of trapeziometacarpal joint. And this next we have the Boxer's fracture. This is a ventrally displaced fracture through the neck of fifth metacarpal. Boxer fracture is for fifth metacarpal. Usually occur in boxer where the injury occurred during the boxing, and this is ventrally displaced fracture through the neck of fifth metacarpal. And the side swipe fracture, this is an elbow injury. This is elbow injury sustained when one's elbow is projecting out of car is slide swept by another vehicle. So that's why we always tell the children to not to keep their hand outside the window in the bus or car. So if there is elbow injuries that occurs when the one's elbow is projecting out of car, and it is sideswiped by another vehicle, and it has combination of fracture of the distal end of humerus with the fracture of proximal end of radius and ulna, and it is also known as baby car fractures, because baby usually keep their elbow usually out of the car, so this is also known as baby car fracture. And the bumper fracture, this is a comminuted depressed fracture of lateral condyle of tibia. This is comminuted depressed fracture of the lateral condyle of tibia. The lateral condyle of tibia, this is fibula, this is tibia, this is lateral condyle of tibia, bumper fracture. This bumper means the bumper of the car. When the tibia is hit by the car's bumper, then the bumper fracture occurs. And the purse fracture and the bimalleolar ankle fracture is known as purse fracture. Bimalleolar ankle fracture. And the cotton fracture, trimalleolar ankle fracture is known as cotton fracture. And this is bimalleolar. Purse is bimalleolar, cotton is trimalleolar. And the Masonassis fracture, it is a type of ankle fracture in which the fracture of neck of fibula occur. Fracture of ankle with the fracture of neck of the fibula. So that is known as Masonassis fracture. Then next we have the pylon fracture. It is comminuted intra-articular fracture of distal end of tibia. And this is tibia. This is a cotton fracture is ankle plus fibula, Masonassis. And the here pylon fracture is that fracture of the comminuted intra-articular fracture of the distal end of tibia. Aviator's fracture of neck of talus is known as aviator's fracture of neck of talus. And the Chopard's dislocation is the fracture dislocation occurring to the intertarsal joint. Intertarsal joint is known as Chopard fracture dislocation. And we have the Jones fracture, the avulsion fracture of base of fifth metatarsal. The avulsion fracture of base of fifth metatarsal is known as Jones fracture, and Jones is also known as father of modern orthopedic. And the Rolando fracture, the fracture of base of first metacarpal. Rolando fracture is fracture of base of first metacarpal, and this is extra-articular, and the fracture is extra-articular. Fracture of base of first metacarpal. Jefferson fracture. The Jefferson fracture means that the fracture of first cervical vertebra is known as Jefferson fracture. The whiplash injury, the cervical spine injury where sudden flexion followed by hyperextension takes place. That is known as sudden flexion followed by hyperextension. That is known as whiplash injury. And the chance fracture means that it is also called seat belt fracture. The fracture runs horizontally through the bodies of the vertebra, through to the posterior element. And the March fracture, this is usually seen in the profession where there is marching, like the soldier, police, army. There is a March fracture. The fracture occurs to the shaft of second or third metatarsal, base of the third or shaft of the second or third metatarsal. This is fatigue fracture. And we have the burst fracture. It is comminuted fracture of the vertebral body where the fragment burst out in different direction. And Clay-Sobler's fracture, it is an avulsion fracture of the spinous process of one or more lower cervical or upper thoracic vertebra. Clay-Sobler, avulsion fracture of the spinous process of one or more lower cervical or upper thoracic vertebra. Hangman's fracture is a body fracture through the pedicle and lamina of C2 vertebra with subluxation of C2 over C3. This is known as Hangman's fracture, and this is occurring during the hanging. And the dashboard fracture, the fracture of posterior lip of the acetabulum, often associated with posterior dislocation of hip. Dashboard fracture is the fracture of the posterior lip of the acetabulum, often associated with posterior dislocation of hip. We have the straddle fracture. The bilateral superior and inferior pubic rami fracture is known as straddle fracture. And we have the Malgagnis fracture, a type of pelvis fracture in which there is combination of fractures pubic rami anteriorly and sacroiliac joint or ilium posteriorly on the same side. So this is type of pelvic fracture, and there are various different type of combination of fracture in the Malgagnis fracture. The fracture of the pubic rami anteriorly, sacroiliac joint or ilium posteriorly, and these occur in the same side. And the mallet finger, the finger flexed at distal interphalangeal joint due to the avulsion or rupture of extensor tendon at the base of the distal phalanx. This is known as mallet finger. Finger flexed at distal interphalangeal joint due to the avulsion or rupture of extensor tendon. So these all are about various fracture with eponym. So we'll be talking about all this in detail while we'll go with the respective chapters. For now, this is just a slight concept. So thank you. In next video we will come up with the new topic in orthopedic, probably the pathological fractures. Thank you.